In this video, we are going to start by talking about the overall symptoms of COVID-19, including the common symptoms, some of the rarer symptoms, and the complications that could occur from COVID-19. The most common symptoms of COVID-19 are a fever, dry cough, and fatigue. Furthermore, many COVID-19 cases are asymptomatic. However, it is difficult to know how many, because not many asymptomatic people get tested. Some of the not-so-common symptoms that could occur are general body aches and pains, a sore throat, diarrhea, headache, loss of one's taste and/or smell, skin rashes, or conjunctivitis, which is more commonly known as pink eye. Some other signs are low leukocytes and low lymphocytes, which are types of white blood cells. And some more serious symptoms are shortness of breath, chest pain, or loss of movement or speech. Overall, there are 3 severity levels of COVID-19. Mild, which is what the majority of the cases are. Specifically, 81% of cases are said to be mild. The next level is called severe, and approximately 14% of all cases are classified as severe. Finally, the last level is called critical, of which only 5% of all cases get to this point. Some of the main symptoms of the mild cases are fever, dry cough, fatigue, ground glass opacities, which are abnormalities of the lung that can be seen on an X-ray. Furthermore, patients mostly do not have pneumonia, but sometimes they can have mild pneumonia. If one has a severe case of COVID-19, some of the symptoms that could occur are dyspnea, which is trouble breathing, a blood oxygen level less than 93%, greater than 30 breaths per minute, and being admitted into the ICU. The category of critical cases can lead to ARDS, which stands for Acute Respiratory Distress Syndrome, which we will talk about later, respiratory failure, septic shock, organ failure, metabolic acidosis, which is where the blood becomes too acidic, and coagulation dysfunction, where the blood does not clot properly. Finally, other rare complications that have been reported are myocardial injury, which is injury to the heart muscle, arrhythmias, which are irregular heartbeats, neurological complications, otherwise known as complications of the brain, some of these being myalgia, which is a disorder that causes muscle pain, headache, dizziness, impaired consciousness, intracranial hemorrhage, which is bleeding in the brain, hypogeusia, which is loss of taste, hyposmia, which is loss of smell, and a stroke. There can also be digestive and liver problems, hypercoagulability, and thrombotic complications. Next, we are going to talk about the difference in symptoms between the flu and COVID-19. While there are many similarities between the flu and COVID-19, there are some distinct differences. One difference is in the onset of symptoms. With the flu, the cough starts first, which is then followed by a fever. While in COVID-19, it starts with a fever, which is then followed by a cough. COVID-19 does have mostly flu symptoms, such as a cough, fever, and fatigue, but diarrhea can also occur in COVID-19. Some of the common symptoms that they both have in common are fever or chills, a cough, shortness of breath or difficulty breathing, fatigue, sore throat, runny or stuffy nose, muscle pain or body aches, and a headache. One of the main differences between these two diseases is that COVID-19 can result in loss of one's taste or smell, while the flu does not. As far as the severity of the disease, the flu can be anywhere from mild to severe, whereas COVID-19 could cause more severe illnesses in some select people. As far as different age groups who contract the flu or COVID-19, the flu seems to be more serious in younger children compared to COVID-19, while both the flu and COVID-19 are serious in the elderly. Flu symptoms also appear quicker than with COVID-19, as flu symptoms can appear 1 to 4 days after infection, whereas COVID-19 symptoms typically appear between 2 to 14 days after infection, usually appearing around 5 days after infection. Overall, the symptoms between the flu and COVID-19 are very similar, but there are some distinct differences in the symptoms. Overall, the severity of COVID-19 is quite mild, with 81% of cases being mild. Furthermore, most people fully recover and have a good prognosis, except for the elderly and those with underlying conditions. The case fatality rate for COVID-19 is 2.3%, which means that of those who have COVID-19, 2.3% of cases are fatal. However, over half of those fatalities are from patients over 70 years old. So if someone is under 70 years old, the case fatality rate is only 1.1%, meaning that if you are under 70 and have contracted COVID-19, you only have a 1.1% chance that your case is fatal. Furthermore, only the cases in the critical level of COVID-19 become fatal. According to studies, no deaths occur in the mild or severe levels of COVID-19. We will now talk about respiratory and brain complications that could arise from COVID-19.
Respiratory complications that arise in the wake of COVID-19 range from dyspnea with or without chronic oxygen dependence to fibrotic lung damage and are reasonably well known as short-term effects. However, long-term effects are currently unknown. On the other hand, neurological effects after infection by COVID-19 are substantially more characterized than respiratory complications after COVID-19. For instance, while hospitalized or infected by COVID-19, patients can be found to have headaches, dizziness, myalgia, fatigue, anorexia, anosmia, ageusia, confusion or impaired consciousness, strokes, depressive symptoms, and non-restorative sleep. Additionally, although less common, more severe cases such as Guillain-Barré syndrome and multiple types of encephalitis have been found in COVID-19 patients during and after infection within short term. Furthermore, long-term effects are now becoming more characterized from COVID-19, including loss of taste or smell up to 6 months after infection, cognitive impairment, including brain fog, PTSD, depression, insomnia, Parkinsonism, myoneural and muscle disease, dementia, psychotic disorders, and anxiety. Additionally, the chances of these symptoms went up after the infection of COVID-19, regardless of previous dispositions to them. including up to 1 out of 8 patients that recover would have these.